We have Heart Health with Dr. Michael McGill of the Marshfield Clinic, Lakeland Center. Dr. Michael McGill is currently director of the One Heart Nuclear Cardiology Program, which features the first CZT, which stands for cadmium, zinc, and telluride, nuclear camera at the state of Wisconsin.
So, we're going to talk a little bit about heart physiology and talk a little bit about the diagnostic tools that we use. The average heart beats about 100,000 times in the course of a day. And that's an important number. We're going to come back to that. But the heart essentially is a pump, and it pumps blood. It pumps nutrients to the cells. And the main vessel that comes off the heart is called the aorta, and that's a pipe that's about 3 to 3.5 centimeters. And then that pipe subdivides into smaller pipes. They're about 1 centimeter to 2 centimeters that go to your brain, to your arms, to your legs. And then those pipes get further subdivided to eventually to the point where the red blood cells, which carry the nutrients, oxygen, are essentially in a single file line in a capillary. And so that single file line of red cells is adjacent to the cells in your body, and those cells take nutrients from the plasma that's in the blood, and it takes oxygen from the red cells to provide the metabolic fuel for those cells. The other cells of the body, for the most part, if it needs more oxygen, it needs more nutrients, it just takes more. Okay? But since the heart is so metabolically active in the resting state, in order to increase oxygen or increase the nutrients, you have to increase flow. But the problem is if you have obstruction to blood flow, and that's related to one of the most common diseases known to mankind, which is coronary artery disease. And coronary artery disease is essentially plaque that builds up in the arteries, and if the plaque buildup is extensive enough, you have limitation of blood flow, and then you have a mismatch between supply and demand. And coronary disease is really of epidemic proportion. About 50% of people in the United States and 50% of people in this room are going to have some form of cardiac or vascular disease manifestation at some point in their life. Coronary disease is something that we deal with every day. Cardiologists will never be out of business because there's such a high prevalence. But the disease process doesn't start a week before you have the heart attack or a month before you have the bypass surgery. It starts when you're young, and we have, again, extensive data to show that kids 2 years old have the earliest forms of heart disease. So, the best treatment for heart disease is to prevent it. And, heart disease is preventable, and treat the underlying risk factors, which is if you have high blood pressure, get that under control. We know if you have diabetes, get that under control. Exercise, prudent diet, 1, maybe 2 drinks a day helps. Not smoking, those kind of things. So the things that you can control, definitely will help with regard to prevention. Some things you can't control.